It's 2025 and this is the time and the place and the year to review your OSCE preparations. And for this episode, we are going to be talking about the treatment and the technique stations. And I know it's been a while, but I know that you're excited. So if you're ready, let's get started. Anyway, yes. Again, my name is Steph, the massage therapist, and I'm going to give you some insights and tips on how to ace this technique and treatment station. Yeah, it took me quite some time as I actually had an original episode prepared, but then it got corrupted. So, you know what? I'm not going to take this as an excuse. And I got you, girl. So now we are going to start, obviously, by reading what's on the two stations. Okay. For treatment station, selected findings from the client's health history interview and assessment are provided to the candidate. So they're going to be giving this to you. And then the candidate is expected to use the information to design and perform a focused massage therapy treatment that addresses each of the presenting symptoms with suitable techniques within the scope of practice for massage therapy. The candidate should incorporate the principles of massage. Again, principles of massage. That is important. Example, introductory techniques before deeper techniques. Then the candidate is not required to treat the unaffected side. So you do not have to go the unaffected side. Because I know that the rule is before you go to the affected side, you treat the unaffected side first. But again, for this one, go straight to the problem. The candidate will have access to equipment such as oil, lotion, and towels. Hydrotherapy is not available nor required. So it means for those techniques that you can use heat packs or any type of hydrotherapy like trigger points or warm-ups, you don't need to use it. So it means for me, you need to actually warm up regularly. The client will be positioned on the treatment table on his or her underwear, covered by linen and a blanket. The candidate may reposition the client if they choose. The client will not respond to questions about the information on the stem, for example, history findings, but will respond to questions about comfort. The client has already given informed consent, including written consent when appropriate, so that the candidate can proceed with the required task. So, based on that, you kind of know already that you don't need to, yes, you need to follow your principles of massage, but not necessarily doing the unaffected side. So you just go with where they want you to go. You can reposition the client, but this is not the right time for you to ask extra health history questions. Now, before I proceed, I want to include Station 7 techniques here because this is actually how you can study the best for these two stations, understanding what each station would require you. Because the study methods for this is going to be similar with each other. So let's just see what's the difference. So let's proceed with Station 7. In this station, the candidate is expected to demonstrate their ability to perform a variety of massage therapy techniques on a specific structure, anatomical structure or area. A list of six techniques, remember that, is provided to the candidate. The candidate may perform these techniques in any order. It means it's like Remix. You don't need to be very specific on how you would perform it. So it's any other order. Any order, not any other order, as the techniques are not intended to form a cohesive massage therapy treatment. The candidate should perform only the techniques listed. As such, introductory and closing techniques are not required for the task listed. The client will be positioned on the treatment table in his or her underwear, covered by a linen and blanket. The candidate may reposition the client if they choose. The candidate will have access to equipment such as lotion, oil, and towels. Hydrotherapy is not available nor required. The client has already given informed consent, including written consent when appropriate, so that the candidate can proceed with the required task. So I don't know if you noticed, but The technique and treatment station kind of asking you the same thing. They want you to perform a proper massage technique. But treatment station wants you to focus on the area and make your own treatment using the things that you pick or the techniques that you pick. Whilst technique station is focused on the techniques they are going to give you. Okay? So that's the biggest difference. Now, again, treatment station, they're going to be focusing, they're going to give you a scenario, they're going to give you the problem, and it's totally up to you on how you would treat this patient and what techniques you're going to be using for this problem. So this is like you providing a regular massage treatment to a client or a patient, wherever however you want to call them, and make sure that the techniques follow the principles of massage and you do not have to go to the unaffected side. You just treat the problem right away. However, for techniques, it's asking you to do the same thing, but specifically on the technique that they gave you. There's no an introductory or closing technique. So I believe like you don't need to do some flushing here or warm ups. Again, it says here, right? The candidate should perform only the techniques listed, and such as introductory and closing techniques are not required for the task listed. It's very clear. Meaning to say, if they want you to perform C-scooping, you show them C-scooping. They want you to perform trigger point technique, then you show the trigger point technique as it is for technique station. But for treatment, you pick your own technique, you figure it out, follow principles of massage, and see what technique makes sense to be there. Now, what are my study hacks? Can I give you the study hacks? First, learn the techniques. Okay? Learn the techniques. Yeah, Steph, I know how to do, C-scooping, effleurage. Yeah, you do. But you have to understand at least the purpose. Okay? Know the purpose. What are the steps? Right? What are the steps that you need to do to perform these techniques? Because you are your own cheat sheet in the exam. Nobody's going to tell you what's after a warm-up. What do you do when you find a trigger point? Nobody's going to tell you that. You have to learn it. That's why learn the techniques. And having the purpose, knowing the purpose, and knowing the steps would help you figure out. So for example, if it's in treatment station, if you know the purpose of the technique, then you would know when to use it. That's why you need to learn the purpose. But at the same time, you also need to know how to perform it. So basically knowing the steps. What should be step 1, step 2, step 3, step 4, and step 5. And obviously, do not forget to also incorporate your principles of massage. Okay? Let's review that principles of massage. We have general, specific, general. Then we would have proximal, distal, proximal, peripheral, central, peripheral, superficial, deep, superficial. So long story short, you need to understand also how this is used and performed during the exam. You can't just, learn this by theory, because technically principles of massage is used to actually make or do some rhythm during your massage techniques. So this would be very important for the treatment tasks. Okay. So make sure that you review this too. These are the common things that I would really want to focus on when I'm going to start reviewing for these 2 stations. Knowing how to use and when to use a technique. What are the exact steps? Okay. And then obviously incorporating the principles of massage. And number 3, I'm going to put it here. Also add some client care. Okay? For this station, I don't want you to talk a lot. This is an exam. Yes, you have to treat them like a regular client. Don't talk too much. No small talking, no marketing talk here, no sales talk. Get straight to the point, but do not over explain. So for example, you're doing trigger point. You're looking for the trigger point. As you're looking for the trigger point, you're like,
oh my god, I found here a trigger point. A trigger point is a hyper-irritable spot that causes pain, and because of this pain, you're having this tenderness. Because of this tenderness, you're feeling some radiating pain here, and sometimes it could.
there's a lot of things already. Straight to the point. Find the trigger point. You found a trigger point. So let's say the client's name is John. Hey, John, I found the trigger point. It's basically a hyper-irritable spot that causes you pain in this area. I'm going to treat it using trigger point technique. It's going to be a little bit painful, but I'm going to work within your tolerance. Are you okay to start? Then you can start your steps. You see, I explained the purpose, the reason, and how I'm going to be performing it in such a short time. Don't over talk. You don't need to tell your life story or what you know. This is not, the criteria is not asking you to show off the theoretical components. The criteria for these two stations is looking if you know how to perform each technique. Do you know how to find what technique should be used to create a treatment? So knowing these things is essential. It's gonna be so essential for you. Now, I'm gonna give you an example of how you should be reviewing this. So I'm gonna give you a quick hack. Again, this is based from clinical massage therapy or rat race. Some schools call it Green Book. Yes, because the book cover is green, but the book is called Clinical Massage Therapy by Linda and Fiona. Okay. But there are more other books, and it's even on the additional resource of the exam. So go check that out as well. But for this one, I got this hack by reading that whole entire clinical massage therapy book. Okay. It's not a total Bible. It gives you quite of information, but again, there are other books that you can check out as well. So this study hack would actually make more sense if we're gonna use it for treatment station. So I kind of have to make a chart. I'm gonna put in the chart the timeline of the condition, okay? Then I'm gonna put the signs and symptoms, right? And then the techniques that I'm gonna use. And obviously, I'm gonna put here the hydrotherapy component stuff. But because they're not gonna be asking you to do it, I don't want to add it. But for the sake of adding it, sure, I'm gonna just add it here. I don't want to add it, but maybe you just want to watch this for fun. Like the other videos, you watch them for fun, right? Did you? You should. So, timeline. What do I mean by this? Basically, it's based on the condition. Is it acute? Is it early? Subacute. Sorry. Let me rewrite it. Okay. Acute, early, subacute, late, subacute, and chronic. These ones are how the body responds to injury, depending on the timeline. So if let's say the stem or the case scenario they gave you says that John got injured 1 to 3 days ago, then consider that as acute. But let's say, oh, it's like 3 to 7 days, then consider it as early subacute. But if it's, oh, no, not really 3 days, 7 days, maybe 3 to 5 days. But if it's like 5 to 7 days, then we're going to consider it as late subacute. But if it's 7 days to months, then I'm going to consider it as chronic. Obviously, depending on the severity of the condition, this does not always match. So take that with a grain of salt. But on, let's say, the milder side of things, if you see one of these timeline and it's correlating, it means the techniques and the signs and symptoms and the hydrotherapy that you're going to be using will match as well. Hear me out. So now, sign and symptoms. Basically, it's still acute. Basically, it's going to show you the signs of inflammation, which is PRISH, pain, redness, inflammation, swelling, and heat. That's usually what you're going to see on the injured area, right? But obviously not not 5 of the signs of inflammation will always show up. So try to find how many signs of inflammation are present first in the case or how they portray it there, and then see if it matches with pain, redness, inflammation, swelling, and heat. So let's say in that case scenario, the patient just said they have pain, they have redness, and inflammation. So it means you got 3 out of 5. The reason why we need to know how many signs of inflammation you have is because by the time you go for ESA, these symptoms should be less. So decrease in acute symptoms, signs and symptoms. So eventually what's going to happen for an acute injury is they're going to feel better. So now the pain would probably be less, redness is probably less, inflammation is probably less. And that's what's going to happen with early subacute. And then for late subacute, it's going to be decrease of ESA, signs and symptoms. So basically whatever is in here is going to decrease on ESA. However, it's going to start increasing the chronic symptoms, signs and symptoms. So basically there would be trigger points starting to build up, fascial restrictions starting to build up, and this is where you see it. It's like a combination that there is still some swelling, but at the same time there's the chronic symptoms are starting to grow. So now for chronic symptoms, what are you looking here? You're looking for fascial restriction, you're looking for trigger points, you're looking for adhesions, you're looking for decreased range of motion, weakness, depending on the condition, right? So again, these are the things that you need to see. So now how are you going to use it in the STEM? If you see that the symptoms are more fascial, trigger point, adhesion, then it means you should be picking chronic techniques for that specific case scenario or STEM. But then if it's giving you something like acute, then it means the techniques you're going to be using should be related to acute. So now what are those techniques? Simple. Usually we would do some MLD, GTO for acute, muscle approximation. Gonna just shortcut it. Muscle approximation, like GSM, right? And treating compensatory areas. And then for ESA, it's same as acute, because basically you're waiting for the symptoms to go down anyway. For late subacute, you're gonna do if acute symptoms is present. Okay? If acute signs and symptoms is present, do acute techniques. What are those acute techniques? MLD, GTO, muscle approximation, line GSM. There's a lot more in here. You just need to see depending on the condition, but these are some common ones you can do on acute and early subacute. And then in here, start treatment for chronic conditions also. So if in the STEM, it's telling you that, yes, there is still a bit of swelling, but trigger points are starting to grow, then treat the trigger points if you see it on the STEM, right? And then obviously, if it's chronic, then you do your myofascial release. Just gonna put a shortcut. Your trigger point technique, your friction, right? Your PNF, your joint mob, more of the chronic techniques, right? So do you see how this is trying to mix together? You're going to check keywords, and based on the keywords, you're going to match it. If the condition tells you it's acute, then you have to use everything that's under here. If the condition is chronic, then you have to use everything that's in here and address each thing together. And then lastly, obviously it's not needed, but for your extra information, this should be the hydrotherapy method that you're going to be using accordingly. Cold, if it's acute, cold, hot, cold contrast, okay, to reduce the swelling but promote a little bit of circulation. Hot, cold, hot, to decrease the chronic symptoms, but at the same time addressing the swelling, inflammation, the acute symptoms, and heat, because it's chronic. So now if you can correlate all of these together while you're reading a STEM, it's going to be easier for you to figure out which technique should you use, right? It can be a mixture of both. It can be one shot only, but this is a good way for you to actually see, right? That if let's say the timeline is 3 months, and then they say that there's restriction in the back, there's tenderness in the shoulder kind of thing. You need to kind of understand, connect the symptoms also, and see which techniques matches it accordingly. Now, if we are gonna go and correlate this with station number 7, which is technique, this is why you need to really know the purpose of each technique, okay? And also know which, what do you call this? And also know how to perform it. Because yes, in treatment, they're gonna see how you perform it, but at the same time, they're gonna see what's your logic of providing the treatment plan. But for technique, they're gonna be focused on how you performed each technique accordingly. So let me show you that. Okay, for station number 16, for station number 7, techniques, it's really important that you know the purpose, because so that you know how to perform it, right? Obviously, you need to learn your GSMs. How do you properly perform your GSMs? Basically, how do you, well, you know, how do you measure how do you gauge the tissue? When would you use it? And then how would you grab the muscle kind of thing for GSM stuff, like general Swedish massage techniques. But for specific techniques or advanced techniques, here's some of my hacks. My hack is to really know step by step what to do. So I'm going to give you a couple of ones, okay? But again, check your notes, because every teacher performs this differently. I'm only showing you how I learned it at school and how I teach them to my students, okay? For example, trigger point. These are my non-negotiable. First, client care. Brief explanation of the purpose. Again, brief only. Do not say your full story. Just brief. Okay, I found here a hyperirritable spot. This hyperirritable spot is best treated by trigger point. I don't know about the other RMTs there, but let's say I would say that maybe you don't need this. But again, I was taught this way. I passed one take and I did it this way. So again, it's a long time ago. But again, maybe say something, but don't say so much. Okay. So again, going here, say, and again, body mechanics are my non-negotiable. Body mechanics. Now that we know that, I'm going to do my steps. Okay. So how do you perform a trigger point technique? First, you warm up. For this warm up, I usually wanted to do palmar, stripping. I'm just going to pick 3. Okay. I'm just going to pick 3 general Swedish massage technique. Palmar stripping, fingertip, kneading, and then fingertip stripping to find the problem. But then again, according to the handbook, you do not need introductory things. So maybe this is not needed. So it's available for, debate. But if you're unsure, just do it. But do every technique 3 times. 3 palmar strippings, 1, 2, 3. 3 fingertip kneading and 3 fingertip stripping, and say, oh, I find the spot. Then number 2, warm up, palmar. After your warm up, you find your trigger point. Once you find your trigger point, find the technique to use. So again, for trigger point, you have 3. You basically have pincer grasp. Then you have muscle stripping, a method to remove trigger points, or ischemic compression, right? Compression. So for this one, you really need to, show how you perform the technique, how you gauge them, so on and so forth. And then once you find that technique, obviously you perform the technique. And then number 4, you do some flushing. Then 5, you do some stretching. Then number 6, you do some heat. But then again, they kind of don't need that, or maybe this. So maybe stick to 2, 3, 4, and 5, whatever your instructor tells you. But when in doubt, just do the whole thing. It is what it is anyway. So that's an example of how I would remember. It means I'm going to go step by step. I'm going to warm up it. I'm going to pretend that I found that trigger point, and then I'm going to pick the technique I'm going to use. And once I figured it out, I'm going to pretend that I found it, treated it. Once I'm done, I'm going to do some flushing, then stretching, then some heat packs, because it's optional. I may not do that. I didn't do heat packs on my exam. So totally fine. And again, in between, just ask, client care, so on and so forth. But I hope you understand that it's just going to follow the form of it. I'm going to give you another example. Okay, another one. Let's say friction. So you just need to understand how the technique is working. So obviously you do warm up. Then after you do warm-up, find adhesion, right? After you found adhesion, you treat adhesion with cross, fiber, friction, right? Once you found it, you're gonna be doing some flushing, then you're gonna do some stretch, and then you're gonna do some ice, which is C-band, meaning to say you're going to put ice and let the client feel coldness, burning, aching, and numbness feeling around when you put the ice, right? And obviously explaining the rationale of things. So this is how I would perform it. This is how I would study it. So every time I practice for OSCE, this is what I'm going to do with it. Do you understand? Again, I don't know how you were taught at school, so it's going to be very important that you actually cross-check on how it is performed. However you feel comfortable, right? As long as you're addressing the problem and you're performing the technique accordingly, even on treatment, it needs to be performed accordingly. Last one, we have fascial technique. So obviously, step number 1 is assess the fascia using cutting, fascial gliding, skin rolling to see where the restriction is. After that, you do some warm-up. After the warm-up, treat restriction, right? Using the different types of fascial techniques. Skin rolling, cross-hand fascial stretch, torquing, J-stroke, whatever it is. You do it. Maybe do 3 of these. After that, go reassess. Okay. Reassess if fascia is still tight. Then number 5, flush and carry on to your next technique. Okay. So again, I learned this using the process that's done in the book. And the way I remember it is how the way I would be performing it. The reason why I really recommend you to actually learn it step by step is so that you don't panic towards the end, thinking what to do and what not to do when you are already in the exam. As it's really important that you're very calm. Okay. So what are my general thoughts for everything? Number 1, just treat the client like you're treating a regular paying client coming in for a massage. But don't talk too much. Only say the relevant things. Explain it briefly. Gonna do a trigger point technique that will help this hyper irritable spot. Okay, it's gonna be a little bit painful, but I will work within your pain tolerance. Okay, that's it. That's not a lot of storytelling. If other people think it's a lot, then find a way to shorten it down. Focus on the steps. Make sure that you know what's before and what's after every step. That's how you would gauge, because again, they're going to check if you know how to do these things. Second, try to really know how and what's the purpose of why you're doing a technique, especially for treatment. Because what if you did adhesions on an area you're not supposed to do adhesions, right? It kind of needs common sense. But for you to have it, you need to understand the purpose of each technique, even if it's effleurage, so on and so forth. You also need to understand the differences between treatment and technique. Treatment, you would find a specific technique to create the treatment plan. So knowing the purpose is good. But for technique, knowing the steps, okay, knowing the steps and how to perform it properly is what they are looking for. So again, if you do have any questions, feel free to message me on Instagram at steph.palisok, steph.palisok, Palisoc, for any type of questions. And I started opening my Facebook group where I would be posting general FAQs for you every Sunday. That's going to start soon, that you would hear from my Instagram. So again, do not forget to follow me there. I would try to help you as much as I can. So again, if you do like this video, please do not forget to like, share, and subscribe for more videos. Again, my name is Steph, the massage therapist, and good luck to your OSCE preparations. And if you want to see my other videos, go check it down below. And again, my name is Steph, the massage therapist, saying goodbye. Bye.